Hey guys, Trez and Dave here. So today we're going to go over what Medicare Parts A, B, C, and D actually mean. I know this is redundant and we've went over it a couple times, but we really want you guys to understand what makes up a Medicare Advantage plan.
Yeah.
So Part A is usually given to you, and that's when you have a 40.
It's 10 years of working,
Yeah.
40 work credits, Social Security work credits is what they call it.
Then that means you're entitled to hospital stays, skilled nursing care, hospice care, and home health care. Then, so when you turn 65, or if you're on SSDI for about 2 years, you can go to the Social Security office and apply for Part B. And once you get Part B, that coverage is doctor visits, specialists, lab work, X-rays, MRIs, and other preventative services. And so, when for all the people who are new to Medicare, okay, so once you sign up for Part B, that does not automatically mean you are on a Medicare Advantage plan.
Or a drug plan or a supplement plan.
Mhm.
And you can have both Medicare and Medicaid, which is also a misconception. A lot of people think you can't have both. If you have Medicaid, you don't have to pay your Part B premium because Medicaid is paying Medicare on your behalf while you're low income. If you do not have Medicaid, then at the end of the day, you will be paying that Part B premium.
Yep. And so with your Part B, which means that you basically have original Medicare, which means unless you decide to go on a supplement plan or an Advantage plan, you are liable for 20% of services rendered.
Yeah, it's an 80-20 split, and that's what makes up original Medicare is your Part A and your Part B. So as you see here, excuse my HVAC system, but as you see here, Part A and Part B does not mean everything is covered. You don't have your dental, you don't have your vision, you don't have your hearing, you don't have over-the-counters, you don't have transportation. You got to take out separate policies if you don't go the Advantage route, right?
And what we're seeing right now with, like I said, all the new people getting Part A and B, a lot of people are being put on prescription drug plans, and
It doesn't mean you have an Advantage plan either.
yep, it just means that you're getting the very basics, aka just drug coverage, nothing else that you're actually entitled to, and that's what you're paying that Part B premium for.
I had a guy today actually at a call, and a guy asked me, "Why is my Advantage plan cost me $0, but the hospital indemnity policy that we were getting him into?" He's like, "Why do I have to pay for that?" I was like, "Well, at the end of the day, the best way to explain this is." You are in Medicare, right? Medicare at the end of the day is a business. Well, any good, long, sustainable business, anything that's credible, they try to lessen their liabilities, right? Their risk. So Medicare, A and B, your original Medicare, contracts with these private insurers, your Humana, your Aetna, your WellCares, your United Healthcares, your Zing, your Gold Kidney, your Devoted, so on and so forth. And they say, hey, if you take on the risk of insuring this individual, we will give you a percentage of what they, or Medicaid, is paying us for their Part B premium. So for them taking on the risk of insuring you, you get coverage at $0. More often than not, it's a $0 monthly premium, at least for now. Just because a plan has a premium does not mean that's a better plan overall. So keep that in mind. It's all situational. And that brings us to Part D,
which is your prescription drug coverage, which covers generic drugs, brand name drugs, and common prescriptions. And once again, if you only have a prescription drug plan, you're only getting Part D. And technically, like, you're basically on original Medicare.
And without Medicaid, guys, you got to understand, like, you are not cost share protected, meaning you do have some sort of
co-insurances.
There is something called VBID for those that were on Medicare and Medicaid and on a dual policy. VBID is value-based insurance design. It was introduced in 2021, and it was specifically for drugs. It was a pilot program for about 3 to 4 years, and it did not get renewed for 2026. And that's why those that have Medicare and Medicaid now have some sort of copays, unless they have extra help at level 3. Now, we're going to be going into other videos on how to apply for extra help, how to apply for Medicaid, what's the difference between partial Medicaid and full Medicaid. But this is just a general idea of what is Medicare Advantage actually. It is a lot, but 53% of Medicare recipients actually have Medicare Advantage. At least 47% of the population on Medicare either has original Medicare or just Medicare and Medicaid, but not a Medicare Advantage. or maybe they have a supplement policy, and every person's situation is different. So there's a lot of variables that go into that, guys. But Medicare Advantage, it is becoming the most popular option right now. One, with inflation, how expensive everything is getting. You pay as you use the plan rather than paying hoping to use the plan.
The care model.
The value model of care, or model of care, MOC. So it's specifically designed to have communication, transparency between doctors and facilities and overall health, right? When you have a supplement policy, there is no model of care. You're going to pay $200-300 a month for it, plus a drug plan, plus you got to take out dental, vision, hearing policies. That adds up. It's not very affordable right now with how expensive everything is getting. So the more expensive things get in life, the more popular Medicare Advantage plans are becoming, and more popular and more common. It's more. Does not make sense, guys. The more expensive things get, the more popular Advantage plans get. The more popular Advantage plans get, because of how expensive everything is getting, the more you're going to start hearing about hospital indemnity. That's what I was trying to say before I bit on my tongue and slipped on my words and got stupid on you guys. But here, like, for real, this is a lot of information. Subscribe to the channel below for the simple fact it will notify your phone any content we release, any updates. We put the Medicare educational webinars on our channel. You got our numbers here. Do not hesitate to reach out to us, guys.
Yeah, and if you just have a question, you want to stick with your plan, that's fine. We'll give you all the good, the bad.
We're not here to pressure you.
Yeah, that's not it.
We just want you to know what is really out there. Again, not every agent's the same. Independent versus captive agent. Just watch the videos. There's a purpose behind all of this, guys. I'll see you in the next video.
Thanks. Bye, guys.
Yeah, can I go back to the
Here.